Hand, foot, and mouth is a viral illness. It's caused most commonly by the Coxsackie A16 virus, but it can be caused by any of the other enteroviruses. And those viruses seem to be a bit more common in the spring and summer months, so that's why we may be seeing an increase in those cases around those times. We do see this illness more commonly in children below the age of 6 or 10 years old. And they're more common to get infections just because they do have much more of a weakened immune system. But we do sometimes see it in adults of any age. We do find, though, that the rash and the typical symptoms with the fever and the rash that is characteristic does occur more often and more florid in children. And it's spread more easily among them, I think, because sometimes they're in much closer contact with each other, like in daycare settings. And they don't sometimes pay as much attention to personal hygiene, especially hand washing, which is key to preventing the transmission of the virus. Typically, we present with a low-grade fever. And what makes it the diagnosis, it's a clinical diagnosis, is the presence of the rash, which is located in a characteristic distribution. So you can find these sort of blistering lesions that occur within the buccal cavity, on the tongue, the hard palate, and they can be quite painful. And so you often find that children don't want to eat or drink when they have these symptoms, which is sometimes the danger with it. You can also find the characteristic lesions on the hands as well as on the feet, and sometimes in the genital area it can be quite common, and hence the name hand, foot, and mouth, just because of the distribution of that rash. One of the other symptoms to look out for, which is when kids tend to run into trouble, is that because these blisters are so painful, they can sometimes not want to eat or drink, and they get at risk for dehydration. And so that's when you might want to consider bringing them in to see a pediatrician, because you might need help getting the rehydration status. So it really is usually quite a mild illness. It does look worse than it is often just because of how prominent the rash symptoms might be. We recommend for this is just supportive management. So if there's a fever, you treat with your usual Tylenol and Motrin, and importantly, you keep them well hydrated. Sometimes with the lesions in the mouth, that might be quite a challenge. So if your kid isn't taking in much and you're seeing signs and symptoms of dehydration or just looking really unwell, we do recommend you bring them in just to see their primary care doctor, and then we can make a determination as to whether or not we need further assistance in getting hydration status up. So like with most viral illnesses, it kind of, your body has to get a chance to get rid of it on its own, and we just support you in the time that you're feeling unwell with this symptom. And typically symptoms last around 7 to 10 days, and then you kind of get over it gradually. The most important way to prevent transmission is paying keen attention to hand washing, because it's spread through your secretions. You have to make sure that you wash your hands before and after contact with anyone who's sick, before and after eating, the usual stuff. And make sure that you reinforce that in the children, especially at a young age where they don't appreciate the importance of it. We have to be mindful to use hand sanitizers and wash our hands very often.